Skin cancer is a significant threat to Floridians. More specifically, I want to talk about melanoma. You see, in 2018, I was diagnosed with melanoma. It was a pretty rare case, considering that it wasn't found on my skin, it was actually found in my small intestine. This led to a surgery to remove part of my small intestines. In addition, I did 13 months of chemotherapy. Today, I want to really talk to you about what melanoma is, what your risk factors are, and what you can do to reduce your risks. So first off, I want to tell you what melanoma is. Melanoma is a type of skin cancer in which the melanocytes, which are a type of cell, it grows in your dermis layer, it gets affected by the UV light. The UV light comes in contact with your skin, and usually it takes those moles and grows them out of control. And that's where your melanin is, and that's the pigmentation in your skin. As those grow out of control, they like to duplicate. And as they duplicate, it's a malformed cell, and that's generally what cancer is overall. So it's categorized as two different types. You have cutaneous melanoma, and then you have metastatic. Cutaneous is the layer melanoma that's just located on the skin. Metastatic is the type of melanoma that travels throughout your body, and it can become cancer somewhere else. The appearance, as you saw in that picture, can be dark, and it can be malformed, or it can actually be a red spot with pink scales on it. According to the American Cancer Society, it is one of the least common types of cancer. However, it is one of the most dangerous because of its rate of travel. So we're going to go and start talking about the risk factors now. The exposure from UV light is the top risk factor overall, and they do say that the worst time of day to be outside is between 10 a.m. and 4 p.m. This is at the peak of the day when there's a UV light it's at its highest emittance. The next risk factor I want to talk about is tanning beds. So tanning beds, while most fluorescent bulbs have some sort of protectant over it to block the UV light, a tanning bed uses fluorescent bulbs that do not block the UV. Therefore, the more time you spend in a tanning bed, the higher risk is. So by the time you're at 50 hours, you're already at just over 3 times higher rate of risk than someone who doesn't go to a tanning bed at all. Additionally, you have individuals that have existing moles or freckles. You have people with fair skin, they're at a higher risk. Family history, the cancer.net brings to point that while family history isn't the most significant risk factor, they do say that you're at a 10% higher risk than someone without family history. If you had a previous skin cancer, that's again going to put you at a higher risk. Race, Caucasian is at a higher risk than somebody that has darker skin. However, people with darker skin are not out of the picture. Your age also can be a risk factor. The median age, according to the American Cancer Society, is, according to cancer.net, the median age is 50. So as you get a little bit older, it's a higher risk for you. In addition, someone with a weakened or suppressed immune system, such as an autoimmune disease, they're going to be at a higher risk as well. So when we start to talk about minimization of risk, I want to talk to you about avoiding sunlight in the peak hours of the day. In addition, I want to tell you about wearing sunscreen. According to the Mayo Clinic, they say that you should wear a minimum of 30 SPF. I personally wear this. It's a lotion that I put on every morning. It's 45 SPF. You can wear 45, 55. Like they said, anything over 30 is good. However, I just would make sure that I wear it at least in the morning, and then I would reapply if I got sweaty outside. Also, you should wear protective sun clothing. They now have shirts and hats and glasses that are all UFP rated. You should avoid tanning beds and booths, as I talked about in my previous illustration. The more amount of time you spend in a tanning bed, the more risk you're going to put yourself. Should become familiar with your own skin as well. As you start to know what your skin looks like on a normal basis, you can look at it and tell if there's any kind of odd marks or moles or freckles or anything like that. And I also recommend going to see a dermatologist at least once a year. Have them look you over. If you're someone that spends a lot of time outside, it doesn't take much. While I understand this is a lot of information to grasp and hold on to, I really do hope you were able to take away what melanoma is, what the risk factors are, and how to minimize the risks. I really do thank you for your time.